A report by the Care Quality Commission has just been released and reveals some alarming details of alleged sexual abuse cases which have taken place in adult social care services such as nursing and residential homes. In a 3-month period during 2018, 899 such incidents were reported, and elderly women have been found to be most at risk. I'm joined by Veronica Ray, who's the Deputy Chief Executive of Action on Elder Abuse and joins us from Belfast. Veronica, how big a problem do you reckon the sexual abuse of vulnerable adults in social care is?
Good morning, Jenny, and thank you for addressing this important issue this morning. The reality is, as reflected in the CQC report, sexual incidents are happening on a daily basis, on average 7 a day within adult social care. So it is critical that we address this issue, but it is also important to note that allegations of sexual abuse in this notification period made up only 3% of total notifications. So we must balance the two angles. It is a serious concern that older women in particular are being subject to sexual assault in residential care, and we do need to address that. And we're delighted that CQC have invested the time and resource in bringing this very hidden issue into the public domain.
Who's doing the abuse, Veronica? Is it fellow residents or is it staff?
The report identifies almost half of all incidents that were notified and categorised as allegations of sexual assault were carried out by residents, with only 16% containing allegations against employed staff or visiting workers. So what we're seeing here is resident on resident incidents.
So how could things be improved?
I think there are a number of issues that we need to address. We need to end the closed culture around sex and sexuality and sexual abuse within the adult social care sector. So we need to bring these issues to the fore, and we need to stop shying away from having those difficult conversations. I think it is absolutely essential that providers and leaders across adult social care develop that culture where staff can talk about these issues and raise concerns. It is also important that we have guidance for staff supported by robust training, and we also believe that CQC should continue to improve the system of provider notification.
How are homes actually monitored?
CQC implements a process of monitoring and inspection of all adult social care, and so they are the regulator there and in the lead in that sense.
But why then, on a day-to-day basis, are people, whether they're fellow residents or staff, getting away with this?
Yes, there is an issue around staff and their confidence in identifying and reporting incidents. There is also an issue around providers reporting on and notifying CQC. There's a massive training and education need in the sector at the moment, and we would be recommending that providers consider how they can address that as we move forward to eradicate this issue. It is absolutely, utterly devastating for anyone who is affected by sexual abuse, and in particular older people. And in these cases that we're looking at people with dementia, people with serious medical and health issues. So the impact of this is utterly devastating, and we must get out of this situation where we're afraid to discuss the tough issues.
Now, the report mentions what you just mentioned, this idea of the intolerance of older people being able to be open about their sexuality. Why is that the case? Why can people not talk about their sexuality in that kind of place?
I think that that's reflected right across society, really, whether older people are living in residential care or in their own homes in the community. I think that sex and sexuality among the older age group is something that we just generally don't talk about. I think older people in particular are extremely private. The report, though, does highlight some really good examples of good practice. For example, one older man had a photograph of another man beside his bed. And only through a long process with well trained and committed staff, that older gentleman was able to actually finally declare that he was gay, and he had never come out to his own family. So that's an example of really good practice where staff are engaged, open to the conversation and asking the right questions. So we need to see more of that.
What sort of training's available for staff to ensure that they are aware of that kind of thing?
We have had adult safeguarding law, policy and practice for many, many years, but unfortunately often training is where we fall down in adult social care. So we would like to see heavy investment in training, but also in guidance. We need to see the production of guidance for not only care workers but also leaders across adult social care. Staff should be empowered to talk about sexuality with residents. They should be empowered to raise concerns about safety as well.
Now, there will be people listening who are concerned about relatives or friends who are in care homes. We've heard, of course, of some families using video cameras to monitor their relatives. What can you do if you're worried?
I think the first port of call would be to call our free phone helpline 0808 8808 8141. And that's free to call and entirely confidential. And our helpline staff will be able to give advice and guidance on signs of abuse, but also self-protection as well. And that would be the first thing I would recommend.
Veronica, great. Thank you very much indeed for being with us this morning. And we will put details of where you can go if you're looking for help on the Woman's Hour website. It'll be a little later, but it will be there eventually.